The commemoration of Breast Cancer Awareness Month in October reaches a high point, with the Office of the First Lady, Madam Fatimata Barrow, leading efforts to raise awareness on its effects in the Gambia, where breast cancer is one of the major causes of death among women. The First Lady, Madam Fatimata Barrow, partnered with the Cancer Confrontation Care and Consolation The Gambia, C3G, Q Group Foundation, and AfriCell to roll out a massive breast and cervical cancer awareness drive at the Bundung Maternal Child Hospital. The First Lady said the initiative is an important move offering free breast and cervical cancer screening for at least 500 women. According to research, breast cancer patients in the Gambia do not survive the disease after 5 years.
The main reason for this is my sisters and brothers in the late appearance and late diagnosis of patients with disease in our country. WHO had made known that one of the most effective tools in any nation's fight against breast cancer is self-examination and breast clinical examination, which are part of the activities that we are encouraging today.
President of C3G, Dr. Abubakar Jah, stated that women must periodically undergo breast and cervical cancer screening to detect symptoms at the earliest stages for successful treatment.
If you look at the name of C3G, we encompass all the 3 factors that we can use to fight cancer. One of them is confrontation, which is what we are doing today. The other one is care. And I am very happy to say that C3G has been able to work with the Japanese embassy. A grant from the Japanese embassy with millions of dollars is given to us, and we were able to buy for the first time a laboratory that is only for the cancer patients.
The Minister of Gender, Children and Social Welfare, Madam Fatou Kinte Sanyang, hailed the efforts of the Health Ministry, which facilitated a monography machine making breast cancer detectable and treatable in the Gambia. Dr. Mohamed Lamin Samate, Minister of Health, said breast cancer is the 3rd most common cancer in the Gambia. Samate underscored that a new monography machine will be inaugurated by the First Lady at the Edward Francis Small Teaching Hospital to support cancer care.
At this juncture, we are happy to tell you from this meeting, the First Lady is proceeding to the Edward Francis Small Teaching Hospital, where she will inaugurate a mammography machine that will start working today. So to the women of the Gambia, His Excellency President Barrow and his government are very much committed to your welfare. This is one of 3 mammography machines that are going to be inaugurated within this period, and the first one will be done today.
The Breast and Cervical Cancer Advocacy Drive aims to promote regular screening with many women ignoring symptoms until it's too late. The First Lady and her team proceeded to Banjul, where she inaugurated a new monography machine for breast cancer screening. Reporting for GRTS News, I'm by Ibrahim Cham.
As mentioned by Ibrahim Cham there, earlier this morning, the First Lady was also in Banjul, where she presided over a major commemoration of Breast Cancer Awareness Month and urged concerted efforts, actions to increase sensitization to end the disease. Madam Barrow also inaugurated the first ever mammogram machine in the country, which was installed at the Edward Francis Small Teaching Hospital. Speaking to GRTS, the First Lady highlighted the importance of the equipment, saying it will improve diagnosis in breast cancer for the women of the Gambia, thereby reducing the stress women face in traveling outside the country for medical assistance. Let's take a listen.
I will continue my advocacy from now. CMD, be ready that there will be a lot of knocks on your door, because you said that when anybody that comes from my office, if they come to you, your doors are open. Make sure that, get ready, every day you meet more than 10 or 50, 20 women every day, because whoever comes to visit me, I'll tell them, go to the hospital, there is a mammogram. And men, be ready too, because men too have breasts. You can be also screened, because men do have cancer too, breast cancer. I was told that there was no mammogram machine in the country, and I started dreaming from that day. I fulfilled the dream. I was able to get a mammogram machine for the country. The first one, it is inaugurated today. It's in process. The minister was the first person to be screened, Another dream I will start dreaming now is to have a cancer center in the country. Help me dream in that dream. Let's together we will achieve it. This mammogram machine was not done only by me. Together we were able to get one mammogram machine, and I think we have three more coming from the US. Whenever we travel, we advocate for the country. We, inshallah, will bring more equipment and will help the health sector, because I believe a healthy country, a healthy nation, a healthy people, a healthy nation. Together we can advocate. I will continue my advocacy from now. CMD, be ready that there will be a lot of knocks on your door, because you said that when anybody that comes from my office, if they come to you, your doors are open. Make sure that, get ready, every day you meet more than 10 or 50, 20 women every day, because whoever comes to visit me, I'll tell them, go to the hospital, there's a mammograph. And men, be ready too, because men too have breasts. You can be also screened, because men do have cancer too, breast cancer. I was told that there was no mammogram machine in the country, and I started dreaming from that day. I fulfilled the dream. I was able to get a mammogram machine for the country. The first one, it is inaugurated today. It's in process. The minister was the first person to be screened. Another dream I will start dreaming now is to have a cancer center in the country. Help me dream in that dream. Let's together we will achieve it. This mammogram machine was not done only by me. Together we were able to get one mammogram machine, and I think we have three more coming from the US. Whenever we travel, we advocate for the country. We, inshallah, will bring more equipment and will help the health sector, because I believe a healthy country, a healthy nation, a healthy people, a healthy nation. Together we can advocate.
That was First Lady Fatou Barbaro speaking at the inauguration of the first ever mammogram installed at Edward Francis Small Teaching Hospital in Banjul. Expanding on breast cancer, earlier in our studio, we spoke to Dr. Lamin Jaites, surgical oncologist at the Edward Francis Small Teaching Hospital, as he discussed on the Breast Cancer Awareness Month and the need for women to visit health experts for screening.
First of all, it's important to highlight why we celebrate Pink October, also known as Breast Cancer Month, because it's actually one of the leading cancers in the world and one of the leading causes of death due to cancer. In the Gambia, it's actually the second most common type of cancer, and the risk factors, as we call them, these are things that expose or increase your chances of getting breast cancer. These are things like positive family history. If somebody, for example, a daughter has a mother or aunt who has breast cancer, they are at slightly higher risk. The age of the individual, the older an individual grows, the higher their risk, both male and females. The female gender, although we've heard in the excerpt that we just saw that men can have breast cancer, which is very true, but about 99% of breast cancer patients are actually women and not men. Things like breastfeeding, for example, do protect against breast cancer. Women who have had children, have gone through the process of pregnancy, are also protected from breast cancer. So again, all these are what they call risk factors, things that expose you to getting breast cancer. But modern medicine hasn't been able to find out exactly what causes breast cancer, and that's why it's important for us to be able to emphasize on early detection, because you cannot prevent breast cancer, but you can detect it if it appears in an individual.
How will early detection help in this case? Because a lot of women would tell you once you have cancer, the next stage is for you end up losing your life, and some are afraid that doing the test or the screening would actually tell them what their condition is, and instead of being able to treat it, they will be thinking about it all the time.
Yeah, I think it's an important point to highlight, especially in our context. When you talk about cancer, people think that it's a death sentence, it's the end of your life. life. I mean, women eventually might fear divorce from their husbands, your family members rejecting you, stigmatizing you. But again, I think that just shows the interest of early detection, because if you detect cancer early enough, you are able to treat it and almost get what is a cure. Meaning that individual will go about with an almost normal life. Statistics have shown that somebody who has early stage cancer and it's treated, out of 100 people, we have 95 who are still alive at 5 years. And at 10 years, you still have about 90 who are still alive. So 90 out of 100 at 10 years after being diagnosed and treated for breast cancer is a very good result. So again, and people go on to live almost normal lives. In our country, where we are resource restrained, it is in our interest that we diagnose this on time, because it would cost us less in terms of the patient's expenditures, and also the hospital wouldn't have to invest so much in the treatment of those patients.
So what has been the worst case scenario?
The worst case scenario, this is something that we see a lot in this country, is that there's a lack of awareness. Women would have breast issues, for example, they have a lump, and then in the local languages they would say that, okay, they're breastfeeding and then a child belched on their breast, and it's normal to have a lump, and that notion goes on. And sometimes, because of that lack of awareness, women who should have been treated at an early stage and perhaps get very good results tend to come in at very, very late stages, wherein even when we do treat them, unfortunately the cancer has spread to other parts of the body. So again, that affects their lifespan, and it also affects the cost of treatment that we're trying to do. So we did a study at the Edward Francis Small Teaching Hospital, where we've noticed about 60% of women who came in with breast cancer actually at a late stage. So again, we emphasize awareness creation and people knowing about breast cancer, and also screening programs. Currently, we have a screening program that is a free screening program in Banjul at the AFSTH. We started today, and it's continuing till tomorrow, Sunday, wherein women can come forward. They can be taught about breast cancer. They can be taught about how to examine themselves, and eventually get free consultations. They can get a free scan done, and they can get all the tests that are done for free, so that they'll make sure that they are free of breast cancer.
Earlier, we've just watched the First Lady launching a new mammogram machine, and for the first time ever in the Gambia. How will this help in cancer treatment?
So basically what a mammogram is, it's like an X-ray of the breast, and it's actually the testing method of choice when it comes to breast cancer screening. Although it's not for everyone, because you have to be at a certain age, above 40, before you can actually benefit from a mammogram. But it's something that can be able to detect very small and early stage breast cancer, and that's the emphasis here, detecting it at a very early stage wherein treatment can be done. Most of the time when you talk about treatment of breast cancer, women, and this is normal, they would fear that their breast would be cut off. And this is something we hear a lot in the hospitals. But again, if somebody comes in early enough, they can have their cancer removed without having to actually remove the whole breast. Yes.
So now that we're in the awareness month, that is what this Pink October is all about. So what will be your message about breast cancer and treatment services?
I think first message is breast cancer is not a death sentence. It is curable. It is manageable if you come on time. And that process has to go through an awareness creation that we are ongoing. Like I mentioned, in Banjul today and tomorrow, we will be screening and creating awareness for any participant who comes to the Edward Francis Small Teaching Hospital. We'll tell them about breast cancer, and we'll also show them how they can actually prevent or detect rather early stages of breast cancer.
Once Pink October is over, is the free screening over as well? Or do you still continue the process?
Well, the free screening wherein they would not have to pay anything for the test is actually today, which we did this morning till the afternoon, and tomorrow Sunday. So those who couldn't benefit from it today, they can actually come tomorrow at the Edward Francis Small Teaching Hospital, and then they would get a free test, they'll get a free scan and free investigations if they need any extra investigations. So after Pink October, in Banjul, the FSTH, we have what's called a breast clinic, and we do see patients on a regular basis. What they would have to spend is very minimal, because in the public hospitals the expenditures are very minimal. They would still get the same services. So first of all, it's important to highlight why we celebrate Pink October.
Dr. Lamin Jaite, surgical oncologist at the Edward Francis Small Teaching Hospital, talking to us earlier on Newsfile. Staying with breast cancer awareness, the Gambia Medical Students Association, GAMSA, UDGAMSA, Medicare and others organized a match procession symposium and free health screening exercise to raise awareness on breast cancer to promote prevention and early detection of the deadly disease. Omar P. Jallo has the rest on that story.
October is at a brimful peak, and advocates around the world are celebrating Breast Cancer Awareness Month to shine light on the ravages of the widespread disease, mostly affecting women. The month-long commemoration helps to mobilize support and bring attention to the importance of awareness, early detection and treatment, as well as palliative care of the deadly disease. The Health and Gender Minister of the University of the Gambia Medical Students Association, Mohammed Jeba, said the sensitization efforts is informed by the urgent need to raise awareness and promote education on cancer, to encourage screening and early detection, adding that the month is also an opportunity to honor cancer victims and support patients and survivors of the deadly disease.
When we say cancer, it is actually different from other types of illnesses that we have around. You know, our only chance with cancer is actually detecting it early. And in detecting that, people must be aware, the public must be aware of cancer. They must be aware of the things that they must do to reduce their chances of coming across such a deadly disease and such a global disease. So that is what prompted this. We are here to educate the entire nation, make sure that everyone knows about this disease and know what they are supposed to do to reduce their chances of coming across this disease.
Fatimata Essadi believes regular checking of one's breast is essential and the first step towards early diagnosis.
At the hospital level, what we keep saying is that people come with breast cancer at a point where it has gone out of hand. This is what we are trying to fight at our own level. So the more you take care, pay attention to these screenings and self-breast examinations that we are advocating, the more the chances of you detecting breast cancer at a very early stage. Because it's something that is very well manageable when you come at phases like stage 1. But when you come with breast cancer and it's already at stage 4, the only thing they can give you is symptomatic care and things like that. So that is what I want to tell people. Take care of yourself and pay attention to this self-breast examination.
Ami Gomez encourage women and girls to focus on their health and respond to emerging conditions through early detection and treatment.
The knowledge that I will gain here will always stay with me, because then my reason for coming will be defeated. So in here I will listen and then make sure I gather enough information and knowledge about it, because my major is law. Then if I get the information, I can go back to the society and disseminate the information, and then not only the society, but also in the school, and then dissemination the information within my peers that don't have the opportunity to come and witness this disease.
Breast cancer continues to be the second most killer type of cancer, claiming thousands of lives around the world each year, with increasing mortality rates for women at 40 years and above.
Breast cancer is a very ravaging disease, and it is taking a toll on mostly our female folks in the world. This event is all about creating awareness for breast cancer. It's important to let people know about this disease and how it affects the human life.
With increasing mortality rate for women at 40 years and above, in 2020, the WHO announced that 2.3 million women are diagnosed with breast cancer globally. And out of this number, 685,000 died from it. This year's team says, Together we rise, in a concerted drive to expand education and public awareness of breast cancer in communities. Reporting for GRTS News, I am Omar P. Jallo.
Still with health matters, UNICEF has partnered with the Ministry of Health to launch 22 hand-washing stations in hospitals across various regions in the Gambia. The intervention joins a major effort by the UN agency to boost hospital sanitation and ease access to water in medical centers. Hawanjai tells us more.
The United Nations International Children Emergency Fund UNICEF is on a committed drive to enhance hospital sanitation in the Gambia. Joining forces with the Health Ministry, the UN agency opened hand-washing stations in various clinics, including the Farafenni General Hospital. The hand-washing facilities are intended to ease access to clean and accessible water for patients and medics during emergency situations, and also to help mitigate illnesses caused by poor sanitation. The Permanent Secretary of the Ministry of Health, Mohamed Lamin Jaite, emphasized the importance of the hand-washing stations in fighting disease and infection.
Sanitation is a key requirement of health, good quality health service delivery. And so having hand-washing stations, we all know the benefits of good hygiene to prevent COVID-19, but not only COVID-19, all other waterborne and airborne diseases that affect children, that affect women, that affect our population. And the hand-washing stations are built to facilitate people's access to clean hygiene practices that will go to prevent a lot.
UNICEF country representative Jonathan Lewis outlined some of the projects they are implementing with the Ministry of Health to promote healthy practices in communities.
During the height of the pandemic last year, the Ministry of Health, together with UNICEF, reached out to the United States Agency for International Development, which was extremely generous in providing a grant of approximately $2 million United States dollars to support two components: increasing vaccination coverage against COVID-19, and the other component has to do with social mobilization, risk communication, community engagement, and water, sanitation, and hygiene. Part of the intervention is to construct 22 permanent hand-washing stations throughout the country. Today, we're here at the Farafenni Regional Health Directorate to do the symbolic handing over of these 22 hand-washing stations to the Ministry of Health.
Health practitioners at the Farafenni General Hospital thanked donors for the gesture, underscoring the importance of hand-washing stations in easing sanitation needs.
This project is very, very important to us, especially our mothers who are coming to the clinic, because we know the importance of clean water that can help our mothers. That is why when we have this structure here, we are so pleased, because before this project came, most of our mothers will come complaining of diarrhea. They understand, but when this came, we talk to them, explain the importance of this hand-wash basin, which we ourselves know it has impact on them, especially our individual mothers.
22 hand-washing stations and other items such as waste bins and detergents were provided for by UNICEF as it advances a strategic effort to promote healthy practices in communities across the Gambia. Hawanjai, Justice News.
Well, the Gambia Red Cross Society recently ventured up-country on a 3-day nationwide assessment tour of the organization's intervention for flood victims. The tour is meant to assess the progress of community resilient projects undertaken across the country. Yara tells us more.
The tour by the senior management is aimed at monitoring Gambia Red Cross Society's programs and projects in provincial Gambia. The team, led by the Secretary General of the Gambia Red Cross Society, Alassane Senghor, visited Toroba Eco Bridge Project, where they planted fruit and woodlock trees for the community forest, and the Child Protection Project in Farafenni, where they also support children with cars and sanitary materials for 3 months. The Gambia Red Cross Society branch officer for North Bank Region, Abdullah Ba, whilst thanking his association for the support, also highlighted some of the areas of intervention, such as planting of fruits and non-fruit trees in the community forest.
The issue of climate change has been a concern for everyone. And we know that the trees are in extinction. especially in these areas, not Bank region. So that is why the Red Cross deems it necessary to come and replant trees. Do you understand? Because they will do a lot. There are a lot of things that these trees can do. They can prevent like winds. Do you understand? They can serve as windbreakers. Do you understand? Especially for this community, as he said, these ones are going to be very helpful because they already have a juice processing center that they have, which is already built, and they have the machines for it. So if these plants grow, it is going to be very helpful for this community and the Red Cross at large.
The national president of the Gambia Red Cross Society, Jato Sila, stressed the need for contingency plans as lessons learned from the last floods has helped them build floods resilience in the coming years.
Gambia has lost a good part of its natural resources, in particular our forest cover. And we are losing our endemic tree species that are very relevant to our ecosystem, that are very relevant to the survival of our animals, wild animals, that are very relevant to our cultural activities. And these are the tree species we want to replace. And Red Cross is very vital to when you come to climate change issues. It is one of our core activities, and it is very, very important for the globally at the moment. We have to ensure that we create a lot of carbon sink, because global warming, we all know that it is a reality.
The Secretary General of the Gambia Red Cross Society, Alassane Senghor, expressed appreciation to their partners both locally and internationally for their support during time of need. The Gambia Red Cross Society's boss hailed the community of Toroba for their steadfastness and urged them to keep up the momentum.
We embarked with our youths tree planting and tree growing, basically fruit trees, but other trees as well. And we have seen some of them are surviving. We have seen greater percentage of survival. Now, what remains to be done is how they can be saved, because we have observed that some of the perimeter wiring that we've done to protect them have been taken out by people.
Jaila Gay of Toroba Link spoke at length on the significance of GCR's interventions while commending them for their timely intervention.
Knowing Toroba is to have a food processing, and then the Gambia Red Cross Society bring fruit trees to roast the plant, and then we are hopeful these trees, when they germinate, it will help us in our processing center, because we will not go outside to buy these fruits. So we will go to the forest and then cut our fruits, the one we want to process and process it.
The talk continues. For JATIS News, this is Sarah Jallo reporting.
Well, a partnership aimed at galvanizing efforts to provide viable market for rice producers is paying dividend as the Giraffe project moves to provide sustainable platforms for buyer-seller linkages. Ibrahim Abba visited some fields in the Central River region with project officials and tells us more.
Production planning is key towards creating better avenues for agricultural development, especially as it relates to agribusiness. The advent of a partnership deal between the Giraffe project and Maru farms in the Central River region south means farmers are at liberty to commercialize rice production in the vast region that is touted as the food basket of the Gambia. In an interview with JATIS during field visits in Jahari and Pachar, a senior agriculture officer in Sapo, Omar Cole, said the quest for food security should be a clarion call for all and sundry.
The seeds were utilized very well because they came on time. We received the maize seeds a week before we have our first rain, and timely availability of seeds helps in productivity. And if you look at most of the farmers in this region, rice farmers, that's Sierra South is known as the potential rice basket of this country. Giving them quality rice seeds will help increase productivity and production. They were utilized very well. Even the maize, we are not enough because every day farmers come to our office asking for more maize, meaning it's something that farmers really appreciate.
Commenting on how his company ensures a readily available market for farmers, the Chief Operations Manager of Maru Farms, Usman Sanyang, said rice being a staple food for Gambians requires huge investment from all stakeholders along the value chain.
Giraffe is really one of our partners when it comes to the provision of seed. Like for instance, past few months ago, we supplied the project with some seed, particularly certain varieties such as 444, Sahel 177, Sahel 134, among other varieties. The project acquired nearly 182 metric tons from the company. These are viable seeds, and as you know, seed is very important. Having a viable seed or having a good quality seed is very, very much important. And thank God the company was able to deliver this required quantity of seed to the project on time, and which is very, very helpful in trying to provide the farmers with the required amount of seed that they need, which is very, very essential.
While thanking government for the giant strides over the years, Mr. Sanyang called for the implementation of policies and programs that will address land tenure issues, particularly for investors.
We will want the government to provide policies and programs that will support the private sector as well as investors into rice production. Let them have access to land. Lands are in abundance, but actually, whenever an investor comes or someone comes and wants to cultivate some of those lands, it's practically impossible for them to use them. The local farmers would not want to give those lands out. But if there are policies and programs out in place, that would definitely motivate or somehow encourage investors to come and invest into the rice value chain, which will go a long way in trying to increase production and productivity of rice in the country, as it is our major staple food.
In the Upper River region, the cultivation of upland rice on large scale is seen as an avalanche for food security, but also commercializing agriculture for economic growth.
Well, as you can see, this is Tumanda district in the Upper River region. A vast area of land is under cultivation and utilization, and the support comes from the Giraffe project. And the farmer that we spoke to have emphasized that this year his harvest is going to be at least 100 bags, and this is upland rice cultivation in this part of the country. Ibrahim GRTS News.
Still on agriculture, because for the sector to be a profitable venture, farmers may need capital and other necessary inputs. In as much as they need resources, they also need knowledge and skills, not only to farm but to help them in the sustainable utilization of their available lands. In the regions, some hallmarks of the PPP government were the introduction of mixed farming centers. The centers work with communities introducing new knowledge on farming. Farmers can learn from the centers some best agronomy practices to boost production and ensure the maximization of yields. Our correspondent in North Bank region, Farmer Kanyi, visited a mixed farming center in Gayan Sanjal, where the PVA 132, an improved maize variety that is gaining momentum due to its early maturing nature and yields. From Kerawan, he sent in this report.
With Adinjane Sanjal Mixed Farming Center, the place is a school where agronomic knowledge and skills are transformed to practice before they reach farmers at field level. I am here to see the performance of the PVA SYN 13 maize, a biofortified variety introduced in the Gambia by the Food and Agriculture Organization.
For us, we did the show in July on the 3rd, and right now we are harvesting stage. Yeah, if you even see, it's due for harvest more than 2 weeks, but due to rain, that's why we even drag back.
Outside the walls of this center, the yield of maize is not as impressive. Many farmers attributed the low yields to the cost of fertilizer and the late supply of seeds.
I will appeal to FAO next year if they can give most of the farmers the seed, whatever they have, they can use that for future uses.
Omar Sanko, M&E officer, told GRTS that his directorate through the Food and Agriculture Organization received about 5,000 kilograms of the improved variety and were distributed to vulnerable and smallholder farmers.
At the direct level, we have devised a mechanism whereby, these seeds were distributed across the region. All the districts, have some allocation, and then the distribution goes through the district extension supervisors.
Aside from the dietary benefits, the variety also has some other significance.
It is a highly yielding too, and then it is early maturing, and then three. The most important is that it is enriched with vital nutrients, especially vitamin A, which has some health benefit, even for the consumers, especially these women and children.
With climate change affecting food production in Africa, farmers are now going in for climate-smart agriculture, where they rely heavily on early maturing crops to combat hunger and food insecurity. A good example of such varieties is the PVA 13 maize. It is early maturing, high-yielding, and climate-friendly. For the news, I am Farmer Kanyi.
You're watching us live from Banjul, and this is GRTS News with me, Rohibite. A quick look at our top stories once again. Rising together to end breast cancer, First Lady Fatouba Barrow is leading a major advocacy effort commemorating Breast Cancer Awareness Month in the Gambia. Boosting hospital sanitization, UNICEF launched 22 hand-washing stations in the health centers across the Gambia in partnership with the Ministry of Health.
The United Nations
and the healing power of natural farming. Newsfile visited a renowned organic farmer and health counselor, putting agrotherapy on a new pedestal. In sports, the Gambia's national handball team has been ranked 5th in West Africa after winning 2 games in the Zone 2 Championship taking place in Conakry. Elsewhere, the UN High Commissioner for Refugees said some 3.4 million people need urgent assistance after destructive flooding in West and Central Africa. Plus, right-wing President Jair Bolsonaro and his leftist challenger Luis Ignacio Lula da Silva are wrapping up their campaigns for the upcoming presidential runoff. Well, that does it for the news this hour. Thanks for the pleasure of your company. Do have a pleasant night and stay and enjoy the rest of GRT's programs. Bye for now.
As the countdown to the global soapies in Qatar edges closer, the national broadcaster GRTS will be airing the FIFA 2022 World Cup games in Qatar live on TV. 32 nations across 5 confederations will compete across 5 host cities in the state of Qatar. The greatest moments in FIFA World Cup history awaits the sporting world. Enjoy World Stars as they showcase their talents and compete for glory. To be a sponsor of the FIFA 2022 World Cup games airing on GRTS TV, call GRTS Commercial Service on 4377-214-996-8585 or 254-7272. The FIFA World Cup 2022 starting November 20th to December 18th, 2022. Be part of this masterpiece event in global football.